That's right.
Hello, Howard University students. I'm Dr. Erica Shirley. I'm a staff psychologist at Howard University's Counseling Services, and I'm here with my colleague.
Hi, I'm Dr. Bridget Neamo, and I'm a staff psychologist at Howard University Counseling Services.
Yes. So,
Welcome.
yes. So first and foremost, we hope that on behalf of the counseling services, we certainly hope that you are safe, healthy, and well during this unprecedented, difficult time. And the purpose of today's video is to talk specifically about how to manage stress and test anxiety as you all prepare for final exams. You know, we can imagine, we know that you've had so many very challenging and fast transitions. You've had to leave campus. You've had to perhaps move back home with family or move in with friends or extended family. And that alone is quite a transition, not only social distancing, the social distancing that we have to do now as we are in the midst of this pandemic. But all the while, we also recognize that you have still had to be a student. You've still had to take classes online. We know that that has been quite a transition from taking classes in person. So you've had to do distance learning. We know that you still have to study and, do assignments and write papers and take final exams. And so we wanted to offer you some support and offer you some guidance on how you might manage the stress that comes of that, and specifically the stress and the anxiety that can come as you take a test and as you prepare for final exams. So with that said, both Dr. Neamo and I have certainly worked individually with several students who have come to the Counseling Center and talked about the anxiety that comes up in particular around exam time. And I know Dr. Neamo has also spoken at length to different student groups on campus, whether it be medical students or pharmacy students or undergraduates. So Dr. Neamo, what are some of the things that students describe when they talk to you about what they're experiencing with test anxiety?
I'm glad you asked, Dr. Shirley. But first, let's talk about what is test anxiety. So, test anxiety is worry or fear caused by having tests. So, you may experience some physical symptoms, which could be upset stomach, sweaty palms, racing heart, fidgety, butterflies in your stomach, rapid breathing, nausea, or headache. Some people might experience mental distraction, difficulty concentrating, easily distracted by noise, uncomfortable by temperature, passerby, and others might experience mental blocks, trouble recalling information, thinking clearly, or you might experience all three. Some possible causes for test anxiety is pressure, past experience, and fear of failure. Some realistic fears is if I'm not ready for a test. Well, you could work on time management. Some people are perfectionists. If I fail this exam, I might have to repeat this year. Well, you can also talk to your advisor, your dean, or your counselor and try to be realistic as you can about your options. In most cases, second chances are built in the system. Some unfounded fears. My family, classmates, or professors will think I'm not very bright. Well, at this level of education, everybody is smart, and intelligence is not the primary factor separating top performers from lower ones. Dr. Shirley?
Okay, so one of the reasons I was thinking about what Dr. Neamo was saying about, first of all, some of the physical symptoms that people experience. And one of the reasons why you may experience those physical symptoms is that's actually your nervous system or parts of your nervous system responding to what is considered in our minds or in our brains a perceived threat. Now, you might be wondering, well, how could a test be considered a threat to my safety? Well, the psyche or the brain can't really tell the difference between a real threat and a perceived threat. It just knows that the worry that you feel or the fear that you feel basically is felt as there's something that my body and mind need to attend to. So a lot of the physical symptoms that you may experience as a result of test anxiety are actually considered adaptive or normal. The issue is that they often interfere with your ability to actually take the test or to perform well on the exam, as in recalling the information that you've probably studied so hard for, recalling the information that you've absorbed in class and that you've reviewed, focusing on the questions, thinking clearly, recalling information, remembering information. So the ways in which our nervous system is responding to the anxiety makes it very difficult for us to actually perform on the test. So first and foremost, one of the ways in which you can manage some of that anxiety and those physical symptoms is by relaxing your nervous system. You have to relax your mind and relax your body before you're able to move forward. So Dr. Neamo is going to demonstrate, and I'm going to be her participant, and she's going to help us to calm our bodies through what's called diaphragmatic breathing or abdominal breathing.
Yes. So Dr. Shirley is going to be my demonstrator. So I want you all to sit in a comfortable position with your eyes closed. Place one hand on your stomach and the other on your chest. I want you to breathe deeply through your nose, filling your belly with air as if there was a balloon being inflated in your stomach. The hand on your chest should remain fairly still. Then slowly exhale through your mouth until all the air is pushed out of your stomach. Repeat this cycle, counting after each exhale. Count up to 5 and then begin a new cycle. So let's begin. Inhale. I want you to hold it for 2. Inhale. 1, 2. Exhale. 3. 1, 2, 3. Slow breaths. Let's do it again. Inhale. 1, 2. Deep breaths. Exhale on 3. 1, 2, 3. Let's try it again. Inhale. 1, 2. Deeply through your nose. Exhale out your mouth. 1, 2, and 3. One more time. Inhale through your nose. 1, 2. Exhale. 1, 2, 3. Okay. And you can also use affirmations instead of counting to calm or peace. So that's what we call deep breathing or diaphragmatic breathing. That's an exercise you can do before taking your exam or during, and also after.
Yes, exactly. And just to kind of, as the person that was participating in the breathing, I must say, even though I wasn't feeling so anxious before the breathing, I even feel sort of more of a sense of calm, even in that quick exercise. So that just lets me know that, deep breathing can be really effective, and it can be a quick tool to use when you're feeling anxious and your body is feeling keyed up and you may be experiencing shortness of breath or heart palpitations or just a sense of feeling unsettled. And I know, and Dr. Neamo, you may agree with me on this, I know that I will often tell students to start to practice diaphragmatic breathing even when you're not anxious, so that it becomes effective when you actually need it. I'll tell
Make it a
students,
habit.
a habit, exactly. I'll tell students to try to practice it maybe 3 times a day. So when you wake up in the beginning of your day, in the middle of your day, maybe around lunchtime, and then at the end of the day before you're going to bed. But again, so that it becomes a habit, it becomes a standard practice. So then when you are actually taking the exam and you start to feel anxious or nervous, you can call on that and it can quickly help you to just calm your body and calm your mind.
Yes.
Because that will certainly help you to reset, so to speak, or become a little bit more balanced and more centered before you actually have to engage in the test.
Yes, it can reduce the tension because I know for me, Dr. Shirley, I carry my stress and tension in my neck,
Yeah,
shoulders, and back.
me
So,
too. Yeah,
yes.
I think a lot of people do. So speaking of that, speaking of muscle tension, another relatively easy tool to use, especially when you're feeling anxious, physically anxious, is called progressive muscle relaxation. And I'm going to facilitate and give instructions on how to do that while Dr. Neamo is going to be my. Are you ready, Dr. Neamo?
I'm ready.
Okay.
All
So
right.
first and foremost, I want you to, if you feel comfortable enough doing it, I want you to close your eyes again. And I want you to shift awareness to your breath. So you hear us going back to breathing into your breath as a quick way to calm the nervous system, and something that breath and breathing being very attached to a sense of calm. So take a few cycles of inhale and exhale breaths, just a few. Now I want you to scan your body. And I want you to scan your body without judgments or adjustments. So as in just observing and bearing witness to how your body is feeling, no matter what that feeling is. You don't have to be critical of it. You don't have to change it right now, but I just want you to observe and bear witness. Okay, so now I want us to begin. So progressive muscle relaxation is you're gonna be tensing your muscles, one muscle group at a time. Now you might think to yourself, that is really counter to relaxing. Why would I tense my body if I am trying to relax my body? Well, you're gonna see that it's really to help you learn how your body feels when it's anxious, when you're feeling physically anxious. You're going to be mindful of how your body is feeling when you're in that keyed up moment. And then you're going to learn how to then relax it to get to a more of a state of calm. So first, one muscle group at a time. So Dr. Neamo, first I want you to tense your muscles of the face. So what that looks like is I want you to either grimace or tightly close your eyes and clench your teeth. As you inhale and hold the tension for 8 seconds. So I want you to clench your teeth, tightly close your eyes, inhale for 8 seconds. So I'll count down. 8, 7, 6, 5, 4, 3, 2, 1. Let go. Now exhale and relax the tension completely, letting your face relax fully as if you were sleeping or enjoying the feeling of release and rest. And I want you to do that at home. I want you all to do that for 20 to 30 seconds. In the interest of time, we won't take the whole 20 to 30 seconds today, but I do want you to release for about 20 to 30 seconds. Now we're going to move to the next muscle group. So now I want you to completely tense your neck and your shoulders. And inhale while you're doing that for a count of 8. I know, Dr. Neamo, you said that tends to be where you hold your tension, so it's probably a familiar feeling. So I want you for a count of 8 to tense up your shoulders for 8 seconds as you inhale. 8, 7, 6, 5, 4, 3, 2, 1. Now I want you to relax completely for 20 to 30 seconds, releasing that tension.
Woo.
Feel good?
Yes.
Okay, now we're gonna move to the next muscle group. So completely tense your, we already did the face and muscles. So now we're gonna kind of move down the body. So now I want you to repeat the tensing for 8 seconds, but this time with your abdomen and your chest. So tensing your abdomen would mean sort of pulling in, sucking in, right? And I want you to do that as you inhale for 8 seconds. 8, 7, 6, 5, 4, 3, 2, 1 on the inhale. And now I want you to release your abdomen. So loosen your belly for now 20 to 30 seconds at home. Again, for the interest of time, we won't do that for 20 to 30 seconds, but I think you get the picture. Next muscle group is your right bicep, forearm, and hand. So what that would look like is you making a fist in your right hand. Neamo will show us a strong fist, right? So I want you to tense that up for 8 seconds as you inhale. 8, 7, 6, 5, 4, 3, 2, 1. And now on the exhale, I want you to release that fist, feeling what it feels like to stretch out that hand, relax that muscle, and exhale for 20 to 30 seconds. Next muscle group, left arm, left bicep, forearm, and hand. Another fist. While you're inhaling for 8 seconds. 8, 7, 6, 5, 4, 3, 2, 1. Now release. Exhale for 20 to 30 seconds. Next muscle group, right thigh, calf, and foot. So tense up your leg as best you can on the right side. 8 seconds as you inhale. 8, 7, 6, 5, 4, 3, 2, 1. Release that right thigh, calf, and foot. On the exhale for 20 to 30 seconds. And you can probably guess what we're going to do next. The left thigh, calf, and foot. Tense it up. 8 seconds on the inhale. 8, 7, 6, 5, 4, 3, 2, 1. And now we're going to release. Exhale for 20 to 30 seconds. How did you feel, Dr. Neamo, as we were tensing up and then releasing?
I felt good. I felt the tension in my shoulders and in my calves because I'm a runner. So that
Mhm.
felt good.
Mhm.
I felt the release.
Yeah.
Yeah.
And I want people to also notice the pace that we were going. I mean, like I said, in the interest of time, we couldn't do the whole 20 to 30-second release, but notice that even with the diaphragmatic breathing and the progressive muscle relaxation, for both exercises, we're trying to go at a relatively slow pace.
Mm-hmm.
And that may be that's the pace of calm and relaxation. Um, so usually at the end of the progressive muscle relaxation, you're going to want to return to your whole body awareness, and you're going to slowly reorient yourself to the room. If you've closed your eyes, especially, using your five senses, what do you see? What do you hear? How do you feel? So those are two, the diaphragmatic breathing and the progressive muscle relaxation. Those are two exercises that I think are relatively easy, quick go-tos when
Yes.
you are feeling a need to relax your body. And as I said, it ends up kind of being the cornerstone, I think, to a first step in managing stress and relaxation. I'm sorry, managing stress and anxiety when you're feeling tense and when you're feeling worried and you're noticing your body responding to that feeling of worry. So now we're going to get into some of the ways in which you can manage the test anxiety specifically. So the diaphragmatic breathing and the progressive muscle relaxation, as I said, are ways to just first and foremost calm your body. And that can be used in any setting that is stirring anxiety, whether it be worrying about your exams, worrying about your school assignments, or even during this pandemic, being concerned about um, illness, being concerned about loved ones, being concerned about how our lives have changed and what's ahead. These are still quick ways to just be in what's called the here and now and relax your body and mind in the moment. So back to test anxiety specifically. So I want to talk to you a bit about how might you prepare before the exam in addition to studying, right? In addition to reviewing all the material. How might you prepare for test anxiety? Because again, it's not whether or not you feel test anxiety. I think on some level, most people feel a certain level of anxiety as they're about to do anything that may have some perceived risk to it. And certainly taking a test or taking a final exam can be considered one of those things. So it's not about, I hope I don't feel it. It's more so, if I do experience it, how much am I feeling it? How intense is it? And how might I prepare myself for if I do start to feel very worried and anxious during the course of the exam? So, and that begins with your prep before the exam. So first thing that I have on my list is putting things in perspective from a cognitive perspective. So this is how you're thinking about the test and your attitude about the test moving forward. I think one of the things, if you recall Dr. Neamo saying initially, was that sometimes our fears can be what we call in psychology catastrophic concerns, or we can use catastrophic thinking. And that is, for example, if I don't do well on this test, then my future is ruined in some way, shape, or form, right? I may not pass the class altogether. I may not graduate from college. I may be considered a failure.
Oh, yeah.
So these would be, this would sort of be put in the category of catastrophic thinking about this one particular final exam. And so putting things into perspective is important, reminding yourself that while the upcoming exam is important, and we appreciate that, it does not determine your entire future. You will likely have multiple chances to academically perform and move on from that particular test. So
And
it's
it
important.
does not define you, that
Doesn't
one test.
exactly, that one test doesn't define you. So it's important to go into the test, and as you prepare for the test, to think about it in that way. Something that one of my colleagues often says when he is talking to students about test anxiety is, it's important to not think about what grade you're going to get specifically, because that can often interfere and that can often stir an anxiety that may not be helpful. Instead, you might want to think about, well, how can I master the material? I've had a whole semester of material. I've been going to class. I've been reviewing my material. Let me just focus on absorbing and remembering and understanding, first and foremost, as much of the material as I can. And usually that goes hand in hand with performance, right? But there's something about focusing on mastering the material as opposed to a particular letter grade that I think can help to calm some of the test anxiety. Secondly, reminding yourself of past successes. So I think oftentimes me and my colleagues, when we're hearing students express what are maybe more catastrophic thoughts, we often ask them, well, what's the evidence? What have you actually lived? What have you experienced? And oftentimes people can call up when you're scared about a test. It's important to think about, well, what have been my past successes? And no matter how small, I did well on a quiz, or I did well on the first and second test. So I know that I can likely, if I put my mind to it and I prepare well enough, I can likely do okay on this test. So often just thinking about the times that you have weathered other challenges, which we know that you're doing right now. A third thing on my list is, don't give the test the power to define you. So as Dr. Neamo said, verbatim, don't give the test the power to define you. The test is a test, and it's made to basically kind of let your professor know how much you've mastered the material, but it doesn't define who you are. It doesn't define how smart you are. It doesn't define how successful you're going to be. It is one test, so keeping it in perspective. Another technique is, before you even take the test, let alone finish the test, just visualizing yourself, however you want to imagine it, successfully completing the test despite your anxiety. So recognizing that you may have fears and worries about how you might perform, but you also have the right to be creative and imagine yourself doing well on that test. And whatever visual comes to mind for you, I would highly recommend that, because that also can shift your attitude about it. And you might be surprised that it can reduce some of the anxiety that you feel. And also reminding yourself, so again, if you feel a bit anxious, it's not an emergency, okay? It's not that you're doing something wrong. Actually, a little bit of anxiety is actually helpful. A little bit of anxiety, or some anxiety, can be motivating and energizing, and it can propel you to actually prepare for the test, right? To actually put yourself into action. It can mobilize you. Now, where anxiety gets tricky is that when it starts to get intense, or when it starts to increase, then it can become immobilizing, which is why we're trying today to help you manage some of that. But a little bit of anxiety is not necessarily cause for concern. It's kind of tapping into the feeling of wanting to prepare and the feeling of wanting to mobilize and do what you can to do the best you can. And then next on the list is, you might give yourself some practice tests. So even if you don't have practice tests available, because it has been a full semester, you likely may be surprised at how much you can predict maybe how your teacher may ask a question, or what they may ask given past tests or past assignments. So as you're preparing for the test and reviewing the material and absorbing the material, you might start to think about, well, what kind of question might show up on the test in connection with this particular concept?
And your practice test, you can time yourself.
Absolutely, right, yeah. So if you are feeling anxious about timing, which some people often do, where even if they know the material well and they've prepared well, there's something about being timed that, I don't know about you, can make me a bit nervous, So I think it can make many people nervous just to know that there's a time limit But a way to approach that, or a way to manage that, is actually practicing some test questions under a certain period of time. And that just gets your mind more accustomed to taking things under a certain period of time. Next thing, and this is something that I know Dr. Neamo preaches and I preach and our colleagues preach, but it's getting a good night's rest. Now that's easier said than done, of
Yes,
course.
it is.
It is easier said than done, especially probably during this time when our schedules and your schedules have all been shifted, and we're all in the same place looking at the same four walls every day to some extent. It's probably hard to have a schedule sometimes, but we know that getting a good night's rest or a good night's sleep is so important to relaxing your body, relaxing your mind, and then you being prepared to recall the information that you've absorbed. It very much can help with that. So not just the night before the test, but maybe you might want to start a couple of days before the test if you're not already on a good sleep schedule, but you might focus on getting a good night's rest. So planning your study schedule such that you're limiting your all-nighters. You
Yes.
may think about limiting your all-nighters, not that we want you to put less time into studying, but maybe shifting when you study so that you're not studying all through the night, but maybe studying through the day and then getting a good night's sleep before the test so that you feel more rested. It actually can help lessen anxiety. Lots of studies have been shown about just how healthy a good night's rest can be.
And can I add, in the night before an exam,
Yes.
having a relaxing evening routine, such as a mug of herbal tea, settling into bed with a good book, um, taking a long bath, playing relaxation music, playing with a pet if you have one, something enjoyable, turning off the cell phone, the TV, putting it in another room, but early bedtime, just cutting it off to study it.
Absolutely.
Yes.
And then lastly on my list before the exam is to perhaps think about limiting your caffeine intake if you're someone that drinks coffee or drinks tea with caffeine, or drinks other caffeinated drinks. You may think about limiting that, because while I know most people think about caffeine as giving you a certain amount of energy and alertness, if you're experiencing an unusual level of anxiety or unusual degree of anxiety, it can actually increase anxiety and worsen it. And we're trying to manage the anxiety that interferes with successful test taking. So I would think about limiting your caffeine intake before the test. So that's on my list. And by the way, a lot of this list you can find, and we'll put a link up, but a lot of this list you can find on Brown University's counseling center website. They've done a very detailed, and they've even given even more guidelines, but for the interest of time, we're just talking about a few. But in reading and researching the guidelines that they give, I think both me and Dr. Neamo noticed that, these are very common, this is very common feedback and guidance that most therapists and most probably college counselors would give to students. So I know Dr. Neamo has some techniques or some guidelines or feedback for what you can do during the test when you start to feel anxious.
Yes. So during the exam, go to the exam early. Try to avoid talking with other students right before the exam. And also go and choose your seat. Get a place in the front, with few distractions. I know when I was in school, I had my seat, my favorite seat. I would go early and get my seat in the front of the classroom. Also, remind yourself that you don't know all the material and that it could possibly appear, or that you don't know all the material that could possibly appear on the test, and no one else does either. Expect a few curveballs on the exam. You're not going to know everything. If you begin to have negative thoughts, say stop to yourself and remind yourself of past successes. Um, Also, remind yourself to have your toolkit. Some of the exercises that Dr. Shirley and I shared with you, you know, remember those in your emergency toolkits. And also banish all thoughts of how well or poorly you might be doing on the exam. Stop the negative thoughts immediately, because that could be debilitating and paralyzing, and start the other stuff where you're forgetting what you're doing and all the materials that you studied so hard for. And do not obsess about running out of time on the test. Check the time periodically, but don't obsess about the time. And the most important tip is approach your studying seriously, but think of the test as a game. Your goal is to collect as many points as you can in the time available. Don't obsess about a particular difficult question. If you're unsure of the answer, guess and move on. Remind yourself that you can miss several questions and still do well. And that's all I have on my end about doing the test.
Yes, and I don't know if you mentioned this, Dr. Neamo, but it just came to my mind is, expect some challenging questions. At this point, in college, you're expected to be challenged. You wouldn't be getting your education if it weren't challenging in some way. So you're not supposed to know everything. So again, it's about mastering the material as best you can, knowing that this is a level of education where you are going to be challenged. And you likely have been rising to the challenge time and time again. So there's nothing different about this time around, about this particular set of final exams. So anything else, Dr. Neamo, or?
And no, and we're going to hang some files on how to answer different questions about matching tests, fill in the blanks, multiple choice, and essays that'll help you also. Some more test taking tips.
Exactly.
Because we want you at the Counseling Service and Howard University to be successful and succeed.
That's right.
So it'll be part of your emergency kit, toolkit.
Right. Exactly. And I know that I think some students have said that for distance learning in particular, it may be that whereas you used to be able to go back and check your answers or go back and look at a question again, there may be some exam formatting online where you cannot do that. So it's important to think about, again, recalling the information as best you can for that particular question, giving it your best guess based on what's called an educated guess, which is based on what you've studied, based on what you know about that particular concept or subject matter, focusing on giving it your best guess, your best educated guess, and then moving on to the next question, feeling secure that you've given it your best educated guess. You've been in class all semester, you've read the material, you've reviewed the material, you've absorbed the material, you've done your best. And so now it's just a matter of giving everything, not that you're guessing on everything, because I'm sure there are probably some questions that feel easier than others, of course, but if you get to a question and you're not able to go back to it, focusing on what do I know about this particular concept or this particular subject, you may even jot it down, and then based on the answers that I have here, or based on what I know, what is my best educated guess, and then I'm going to move on feeling okay that I have done my best, essentially. So that's what I would add to that. So we're going to say goodbye for now. We hope to engage with you this way on other topics. And again, we really miss being able to see you in person. And we miss being able to be on campus and engaging with you in person. Dr. Neamo recently sent me some pictures of the yard, and I was feeling so nostalgic about it and missing campus myself. So I'm looking
It's
forward.
empty.
It's empty, yeah. I'm looking forward to engaging with everyone once we're back on campus. But for now, I'm hoping that this serves as another kind of support and another source of support. And just know that, you know, already, even prior to you completing your finals and prior to you completing the semester, we are very proud of you because we know the kind of resilience that it's probably taken to shift gears so quickly, and the challenge of transition and the challenge of having to learn perhaps in a different format. And so already we are very proud of you. We hope this was helpful, and we hope to engage with you again soon. And take care, and take care of yourself as you prepare for the exams.
Yes, and we wish you well and much success.
Yes.